And we've all been there. You've been there. You're draped in a paper gown with your clothes and your dignity in a little pile on the chair next to the cold, uncomfortable table where we wait and wait and wait for the doctor. And when the doctor finally arrives for your visit, you try to cram in as much information into one sentence as you can. You know, you're enduring invasions of cold speculums and other instruments of torture, and I'm not laughing at the situation. I'm just laughing at if you look at it from an outside point of view. Like Adam's Funny Films and thepompouswindbag, we have a lot of fun. It's all about having fun. I mean, we have the cameras and the lights, and I can see my producer right through the glass there. But this is serious. This is your health. This is your life that we're talking about. When the pelvic exam is over, the doctor stands up and says, well, everything looks great. See you in 6 months. And you get dressed and you wonder if the doctor actually heard anything that you were talking about. You know, your pelvic pain, irregular bleeding, medication intolerance. You know, the list goes on and on. So you go home feeling worse than you did before you even went to the doctor, and you wonder if you will ever get help from the medical establishment. Well, this is a sad reality of the life with this disease. Did you know the average delay in diagnosis for endometriosis patient is around 9 years? 9 years, and that's in some places. Some places are different. Not everybody. Not every. You're blessed if it happens right away. Endometriosis is a condition which the tissue that normally lines the uterus grows in other areas of the body, and it causes pain and bleeding and possibly infertility. So this is a serious subject that I've decided to talk about today. So how do we become partners in our health care and get our physicians to listen? First, find a doctor who can successfully treat your endometriosis. OBGYN, OBGYN. Now that's an acronym for obstetrics and gynecology. And that's the discipline that primarily treats endometriosis. The best endo doctor referrals, they seem to come from word of mouth. So talk to other endo patients and find out who their doctor is and what they think of the doctor, and if they would feel comfortable recommending you. Contact support groups in your community. Talk to the Endometriosis Research Center. Search the internet. The internet. It's there, man. Use it. Board committees. Your local hospital. The medical board of your communities. There are several endo experts out there, many of whom take various forms of insurance. So that's good news. Get to know your doctor's capabilities. Oh yeah, that's a big one. It is important when selecting a specialist to treat your endo that you are aware of the doctor's capabilities in treating the disease. I mean, you know, some questions you may want to bring along with you to the appointment. I'm going to tell them to you. Well, I might as well bring them up right now. Say this right to your doctor. How much of your practice is dedicated to obstetrics? And how much of the practice is dedicated to gynecology? Now, this can be helpful in determining whether or not your doctor will be sent off to the delivery ward during your appointment time. Now, don't laugh, because it happens all the time. And I'm sure some of you know what I'm talking about. It happens all the time. So it's important that you know how much time the doctor spends with gynecology or obstetrics. How familiar are you with this disease? Do you have many endo patients? Do you keep up on the latest information surrounding the disease? You know, ask the doctor this. Ask the doctor, what do you believe the proper course of treatment to be? Now, one note here, if the doctor says pregnancy or hysterectomy without even examining your records and dismisses all other methods of treatment, you may want to thank the doctor and see yourself to the door. Ask the doctor, what method of surgery do you utilize to remove endometriosis lesions? If you believe excision to be more successful than simple cauterization or ablation, then you would likely wish to select another doctor who does perform that type of surgery. Do you have colleagues consult with you in the operating room in the event that the disease presents itself in an area outside of your expertise? You know, ask. Bowels, bladder. Often surgeons leave endo in these areas to professionals who are better suited to treat it, such as gastroenterologists and urologists, urogynecologists, for instance. Ask your doctor, do I have access to all of my medical records at any time I wish? It's a fair question. Ask. Other things to consider, do you feel comfortable talking with your doctor? Think about that. Do you think that you will be able to be an active partner in your health care with that particular healthcare provider, or do you feel as though they are in charge? Now, there is a long-standing joke in many patient circles. What is the difference between God and a doctor? Well, God doesn't think he's a doctor. You know, so if your physician gives you the impression that you will have no say in your treatment, then that doctor may not be the doctor for you. Now, if you are not already diagnosed, tell your doctor what you are feeling and why you suspect you might have endo. Do you have any of these following symptoms? You know, reproductive bowel, urinary tract endometriosis. And that is chronic or intermittent pelvic pain, painful menstruation, and that's not normal. If it's painful, don't. Infertility, miscarriage, ectopic, tubal pregnancy, IBS type symptoms, including cramping, bloating, diarrhea, constipation, painful bowel movements, sharp gas pains, stuff like this. Dyspareunia, that's pain during intercourse. Pain after intercourse, back pain, leg pain, blood in your stool, rectal bleeding, tailbone pain, blood in urine, tenderness around the kidneys, painful or burning urination, flank pain radiating towards the groin area, urinary frequency, retention or urgency, and hypertension. These are things you need to be aware of to know if you may be suffering from endometriosis. Lung endometriosis is as follows: coughing up blood or bloody sputum, particularly coinciding with menses, accumulation of air or gas in the chest cavity, constricting chest pain or shoulder pain, or shoulder pain associated with menses, shortness of breath, collection of blood and or pulmonary nodules in the chest cavity, and these things will be revealed after testing. It's just chest pain, basically, is what I'm saying. Sciatic endometriosis, that's pain in your leg, which radiates down the leg from the hip, and this symptom is concurrent with both sciatic and inguinal endo. External skin endometriosis. And those are painful nodules that you can see on the skin surface and that bleed during menses, and they appear blue. You might want to get that checked out.